All women who have the good fortune to live long enough will go through menopause, and yet somehow there doesn't seem to be enough information about it. We've been asking for your questions, and that board back there on it are just snippets of the more than 1,000 questions and comments you sent us over just a few days. You want answers, so let's get you some. Joanna Miliotis has a doc on the growing conversation about menopause. You can catch that on the National's YouTube page, but let's take a brief look at the essence of that doc, and then we'll talk.
The menopause community is exploding, especially online.
All of these things that can kind of creep in insidiously in perimenopause.
There are midlife influencers.
They've earned their stripes.
Celebrity wellness lines.
For today's Menopause Minute, I'm going to talk about how we diagnose.
And doctors informing and advocating for women's health.
There's often a lot of confusion about it.
There are some dubious claims out there too, promising quick fixes. But the flood of menopause solutions, good and bad, experts say, stems from a glaring lack of research and knowledge in the medical community.
How to advocate for yourself at your healthcare provider's office.
A blind spot rooted in the notion menopause is something women just have to endure.
Why are we so behind on this area? It makes no sense. That's right.
Trish Barbato and Janet Cove co-founded the Menopause Foundation of Canada last year.
We have 10 million women in our country over the age of 40. We're 1/4 of the population, and we make up 1/4 of the workforce. And yet our needs related to menopause have largely been ignored. And that's not acceptable.
The foundation recently released a landmark study. It found women were often blindsided by menopause and the sheer number of symptoms that can come with it.
Most women are aware of hot flashes, period changes, but there's 30+ symptoms of menopause. Things like heart palpitations, urinary tract infection, pain during intercourse, there's low mood, there's anxiety. So there's a whole host of symptoms that if you don't understand that that's part of perimenopause and menopause, you're not able to connect the dots, and you're actually not able to manage your own health.
So, Joanna, thank you for kicking off this conversation. We have a lot to talk about. I'm so curious, what surprised you?
The sheer number of women going through it is a big one, and Janet mentions it in the piece, but it's also the sense of gratitude that we encountered from women that were even having this conversation openly. And it doesn't take long to discover that this is really a feminist movement. These women who are leading the conversation are really confronting and challenging the ageism and sexism behind the shame and the stigma and the real barriers that exist in accessing care.
Okay, so let's talk about those barriers. Let's talk some answers to so many questions women have. We have some help here. Dr. Shafeena Premji, a family physician. You're specializing in women's health, and Shirley Weir. You're the founder of MenopauseChicks.com. Great name. I think you fielded something like 100,000 questions last year. So I'd like to start with you. Why did you start that, and what is the most frequent question you get?
I started Menopause Chicks because I saw a huge gap, especially in the online space, for women to get informed. And while you might think that the most popular question is hot flashes, women want to talk about sleep, stress, and sex because it's impacting their lives at home and at work.
Okay, we're going to get to some answers there. Why is it difficult, though, Dr. Premji, to get medical help? Why do we keep hearing women say it's just so tough to get help?
As a family doctor, we go through 2 years of training, and in that 2 years, there's so much information that we need to learn about, and menopause and the care of women in the midlife is very minimal, if anything at all. And so the menopause piece is really just not covered. And when I went through my training, I had to go and seek out this information on my own to be able to understand what women go through, and also to be able to understand what therapies are available that are Health Canada approved and that are effective and safe. So this is where the challenge lies. In my home in Calgary, there isn't even an actual menopause clinic. Patients don't know where to be referred to.
We have had so many questions. Let's get to one of them right now. Let's have a look.
How do I know when I'm going through menopause or perimenopause? What are the symptoms?
The most basic question you can ask, right? How do I know? What are the symptoms, Dr. Premji?
I guess it first comes down to your last menstrual period. So you have to wait a full 12 months before your period has completely stopped for you to be in menopause. Anything prior to that is considered perimenopause. The average age a woman goes into menopause is around 51. It can range from 45 to 55. What are the symptoms? There are over 30 symptoms that are included. The most common ones that women know about are the hot flushes and the night sweats, vaginal dryness, sexual dysfunction, sleep disturbances, brain fog, I can't concentrate, my mood is up and down, I'm anxious. So there are many other symptoms that are also included.
Shirley, what would you add? I know you know there are more.
Well, I think that what I really want women to know is that we don't go through menopause. We actually reach it, and then we have the second half of our lives to live. And that second half of our lives, you know, our heart health is important, our brain health, our bone health, our vaginal health. So it's not about just getting through to the other side and calling it a day. It's really about an opportunity for us to invest in our health.
I've been very lucky. I haven't had the sleep disturbances. I have certainly experienced hot flashes. I've had them sitting right here. It's lovely when it happens on the air. Are you seeing people saying, should I just run to the vitamin store and get all the magnesium that's out there?
I think it's important for women to understand that a hot flash is a sign. It's like the check engine light coming on in your car, that something is happening in your body. And maybe you can get curious. Maybe you would start at the library, or maybe you would start in your physician's office. It's really going to depend. There are a lot of products at eye level, at shelf level, targeted at our age group, but it's really important that you turn the label around, read the ingredients, and get your advice from an accredited healthcare professional before you start spending money on those products.
And what should you worry about in terms of grabbing the supplements?
The supplement to me means that you're adding something to your diet because it's not coming from your diet. So for me, it's really making sure you're eating the right combination of fruits, vegetables, protein, and dairy.
Okay, we also get a lot of questions about hormone therapy. Here are a few of those.
I'd like to remain on HRT, obviously, because of its benefits, but I'm not sure because the literature out there is quite confusing.
I've been in hormone-induced menopause since December of 2020, and since then I've noticed that my hair is falling out. A lot of it falls out every time I wash my hair. I don't sleep at night. Help!
Okay, before we get to the specific advice, Dr. Premji, what is the thinking currently on hormone therapy?
So the general consensus Canadian and North American Menopause Society guidelines say that if you are under the age of 60 and within 10 years of menopause, hormone therapy is a first-line recommendation for the treatment of hot flashes and night sweats. The decision on whether or not to continue hormone therapy beyond the age of 60 really is an individual decision between the patient and the provider, whether it's the gynecologist or myself as a family physician. Every year we recommend a risk assessment, so looking to see if there's been any health changes. Have you gained weight? Have you lost weight? Is your blood pressure under control? Have you developed diabetes? Do you have high or low cholesterol? Has there been any new cancers that have been diagnosed? And when you make a decision with the patient, it's really looking at whether or not they are continued to be a safe candidate.
I want to go back to you, Joanna. We've heard, sleep loss, hair loss, the whole gamut. What's something else you heard people talk about?
Mental health, that's a big one. You mentioned anxiety as one of the symptoms. There's anxiety, there's depression, there's a feeling of malaise that people can't put their finger on. And when the conversation isn't normalized in doctors' offices and in society at large, a lot of women we spoke to say they felt isolated, alone, sidelined, and so scared at the end of the day because you don't know what is happening.
So Dr. Premji, the anxiety and depression piece of this, if a woman is to come into your office and talk about it, what are the range of options you can give her?
So the first line treatment is always antidepressants, which are called the SSRIs or SNRIs. The single biggest risk factor for depression, anxiety in the menopause is actually a previous history of the same. So a woman who's gone through postpartum depression or a previous depressive episode.
What's one thing that needs to change?
Well, I'd love it if health benefit providers would take a look at the coverages that are available. Viagra is covered on most extended health plans, but not all hormone therapies are covered on extended health plans. And that becomes a big question for women if they're deciding, do I do this path or do I choose this path? Affordability is going to play into that question.
All right, Dr. Premji, Shirley, Joanna, thank you all so very much.
Thank you.